Officer, on behalf of the Scottish Labour Party, I want to begin with a tribute to all healthcare staff on the front line of the pandemic who are working so hard in the most difficult circumstances on behalf of all of us. We couldn't get through this pandemic without the healthcare workers on the front line and those who are behind the scenes, some putting themselves at risk every single day just to keep our NHS going and keep caring for others, not just in terms of risk of the virus, but also in terms of people's mental health and well-being. We all know that this second lockdown is not easy for anyone, and so many people are struggling with the isolation and the pressure that comes from juggling so many different responsibilities, from homeschooling to working from home. We need to get this pandemic under control. We need to eliminate the virus, and we need to give people hope, confidence and assurance that we have a pathway to do so. That's why getting Scotland vaccinated must be our top priority, and getting the rollout of the vaccine right is in everyone's interests. We've heard again today some horrifying statistics from the First Minister. The numbers of people dying every day is far too high, and just one loss of life from this virus is one too many. Our thoughts continue to be with everyone who has lost a loved one. Getting everyone vaccinated safely and quickly is crucial to our COVID-19 recovery, and that is absolutely where our collective focus should be. And that's why we must take very seriously the concerns of clinicians, those in the front line who are sounding the alarm. And in this debate today, if I can say to the Cabinet Secretary, we won't be making these points to have a go at the government, but what we're trying to do on our benches is reflect what people are saying to us from the front line, their families who are worried at home and people who have very direct experience. So the government amendment, whilst it says lots of things that we agree with, but it does knock out most of the concerns that we are trying to reflect from the front line in our motion. So we won't be able to support the government amendment today, but we will work with the government to make sure that all of us get this right, and that when we raise concerns about the front line, we are doing that with the very best of intentions. So I want in particular to commend BMA Scotland and the doctors that they represent, because they have been speaking out about the pressures on the NHS. The current wave of the pandemic and the increased transmissibility of the new variant have placed the NHS under severe pressure, and of course our social care services too. According to BMA Scotland Chair Dr Lewis Morrison, he said, and I quote, "We've used the expression stretched to breaking point so often there's a risk that that phrase loses its meaning, but that is exactly where we are right now." Across the healthcare front line, we know that many others have been raising concerns about the adequacy of current PPE recommendations and what's available to staff, and that's what's reflected in our motion today. The BMA have written to both Public Health England and Public Health Scotland asking for enhanced PPE protection. The RCN also have called for enhanced protection against the new variant and a review of the sufficiency of current PPE advice more generally. Now, I think we would all agree that the virus got so badly out of control in the first place because our governments didn't always act quickly enough during the first wave of the virus. On many fronts, we were too slow on lockdown, on testing and on PPE. So let's not repeat any of those mistakes when it comes to the rollout of the vaccine and the warnings from staff about the need for more protection. We should be taking a precautionary approach. So we need to listen to those on the front line who are asking for better PPE, and we should be providing that to them and trusting their judgment. Access to higher grade masks should be made available to all patient-facing healthcare staff as a matter of priority, because the levels of hospital-acquired COVID infections show that more action is vital now. The Cabinet Secretary knows that I pressed her last summer on the worrying numbers of people catching COVID in our hospital, and we know that we're still not getting this right. In many cases, it looks like it's worse than it was in the first wave. Patients who were admitted to hospital for other reasons have subsequently contracted COVID, and in some cases they have died, and it's an utter tragedy. This morning I was contacted by a concerned member of the public whose mother has caught COVID in the hospital. She said, after keeping my 82-year-old mum safe from COVID all these months, she is now tested positive in hospital. She had a massive stroke before Christmas. I would have thought that all frontline staff and patients would be vaccinated as a matter of urgency, but it's not the case. Mum's ward has been in lockdown, so she's obviously got it from a member of staff. I feel it's not good enough. How many other people are getting the virus in this way? You're supposed to feel safe there, but instead it's proving deadly. She said, I know there's nothing you can do to help us, but I just would like you to make you aware that things are not great within the hospital setting. I know there's nothing you can do to help us. Well, I think we all have to take that point away because we do have to help. And I know that MSPs, all of us, our inboxes are bursting with similar stories. So let's today agree that we're going to do something about this. Because the reality is, when we don't act quickly enough to roll out the vaccine and PPE, people will be let down. And the calls for enhanced PPE is not just the BMA, the RCN, it's also the GMB, Unison and Unite, and I refer to my register of interest. We need a safer system of work for all. I will.
John Mason.
I thank the member for giving way, and I take her point that we want the staff and people to be vaccinated first. But she argues for them getting a second dose before older people. How does she handle that older people are being pushed down the queue?
Monica Lennon.
Well, with respect to John Mason, it's not these benches have been putting older people down the queue during this pandemic. What's happened to older people is an utter tragedy. It's, in my view, a humanitarian crisis, particularly what's happened in our care homes, where I believe that older people have been the collateral damage in this pandemic. And that's why on these benches we have fought for and secured a commitment for a human rights-based public inquiry. And we would want that to get underway now, not wait to some time down the future. I'm reflecting the concerns of frontline workers. So if I can turn to home carers, because they're mentioned in our motion too, they do feel despondent and feel that they have been left behind in the pandemic. They feel that they were last on the list for PPE, last on the list for access to regular testing, and they now fear they will be last on the list when it comes to getting vaccinated. So I think today this debate and our motion can be a signal of intent that home carers, indeed all social care workers, can expect to receive the maximum, not the minimum support from the government. And I do understand the logistical challenges. I've discussed it with the Cabinet Secretary, so have other colleagues sitting round about me, but we just need to work harder because we've got home carers who are going out there into people's homes where people have COVID. They feel they've got the basic mask, they're still not getting access to regular testing, and they're trying to book for vaccines, and when they go online, the vaccine is not there. Absolutely.
Cabinet Secretary.
I'm very grateful to the member for taking an intervention. Just in terms of PPE, I'm sure the member will recall the agreement that I reached with the relevant unions and with COSLA, that in terms of home care staff, it should be entirely down to their professional judgment what PPE they believe that they need, and if they decide, and that PPE should then be made available to them. And if there are instances where that's not happening, this agreement was made some time ago, I asked that I was told directly. I've not been told that, but if I am, then I will resolve it. I'm sure the member would welcome that.
Monica Lennon.
No, I welcome that intervention. I think what happens, Cabinet Secretary, is that people who are managing staff then revert back to government guidance. I think the government guidance is out of date. We've got home carers today in people's homes looking after people who have COVID, and they've just got the basic mask, a basic apron, in a home environment that's poorly ventilated, and they feel it's a game of Russian roulette. So I'm glad we've had that commitment from the Cabinet Secretary, because these are the issues that real people are telling us every single day. So let's get it right for our frontline workers. Presiding Officer, I'll move on in the interest of time. So we need to be faster on vaccine rollout. We need to listen to professionals, those in the front line, about how we can resolve delays when they occur. And I welcome the amendment from Donald Cameron, which does emphasise this point. I've had concerns this week also from a GP. She says, as a GP, we are all concerned about the slowness at which vaccines are coming out to practices, the constant changing timetable of when they will come, and the marked disparity between different areas of Scotland. This uncertainty is not helping planning. Patients are also unhappy that they may be waiting weeks longer than people they know of the same age. And now the government are stating that we'll be rolling it out to over 70s and highest risk groups in the next few days. General practice is ready to deliver. We know we can from long experience with flu vaccines, but we need the actual vaccines and a reliable supply to do so. I know it was a talking point today, the vaccine that is at First Minister's question, so it's of interest to everyone in this chamber. But again, let's listen to these workers and show them that we all mean business, and the government will not just brush away people's concerns, but will act on them. And we shouldn't be in a position, presiding officer, where the NHS can only respond to COVID and little else. We need to address this urgently. Otherwise, the risk of long-term damage to Scotland's physical and mental health becomes more challenging by the day. PPE and vaccine rollout is crucial, not only to ensure COVID-safe workplaces, but also to stop staff absence because of the virus. The NHS workforce are at an increased risk of contracting the virus, and staff shortages caused by the virus or self-isolation is putting more pressure on the health service. We've heard from the President of the Royal College of Surgeons, Professor Mike Griffin. He said that the increasing numbers of people off work is a major problem, especially in the west of Scotland, where we know we've already got high levels of health inequality. In conclusion, presiding officer, I began by paying tribute to our health and care workers. I want to end by doing so again. We cannot get through this pandemic without them. We need to support them, not just with warm words and hand claps. We need to get quicker action on PPE, on rapid vaccination and continued testing. I hope other parties will support the motion, and I move the motion in my name.
Thank you very much, Ms Lennon.